AccuBoost following whole breast radiation is really an important part of the treatment program for women undergoing breast conservation. Studies that came out of Europe showed that women that were treated with just whole breast radiation, 5 weeks of radiation, seemed to have a somewhat higher risk of recurrence than those women who had the boost added on after whole breast radiation. And we've argued in this country how best to do it, but I think the data has been pretty convincing, especially now with 20-year follow-up in those studies, that the boost is an important part of optimizing local control for breast cancer. I think the future of AccuBoost and really breast cancer care is one of evolution. And if we look back into the early 70s when we started doing breast conservation, we started treating whole breast radiation, copying the surgeons doing a mastectomy. Harvard was one of the centers that developed the technique, and we've just continued doing that because it was working pretty well. We knew that there was minor risks of complications, but it was good enough. Until about 5 to 10 years ago, when we started looking at the idea behind partial breast radiation, really started us thinking, how can we improve what we're doing with breast cancer care? And that's when we've seen application of new technology. And I think AccuBoost is an outgrowth of that interest. It's allowing us the optimal way of imaging the breast, which is mammography, to now allow image guidance for treatment. And that really has significantly improved our ability to target and to really minimize the amount of normal tissue we're treating. So we can optimize the treatment of breast cancer while minimizing the toxicity of therapy. And that really is where we've been moving with all of oncology care, but particularly breast cancer care.